So without any further delay, then I will move on to our first question. And the first question on the list is about airplane travel. So this person asks, I read an article that airplanes may be safer than we initially thought because of rapid air exchange. And I find it interesting that flight attendants are not getting sick. So can you comment on how safe airline travel is based on the newest information?
Okay, I'll take a first stab at that one. I looked up the information as best I could find it, and I did confirm, or was able to confirm, that the airlines for the last several years have had HEPA filtered air in the air cabins, and that HEPA filtration would take out all the way from 99.7% to 99.999% of particles. And those particles would include viruses. So that means that the air that is going through the cabins is filtered, and there are about 20 to 30 air changes per hour in the air cabin. So that means that in that 1 hour period, the air is circulating through those filters and the particles are being removed 20 to 30 times. That air goes through those particulate filters. And there's also a blend of fresh air and cabin air, about 50-50. So you're getting fresh air into the cabin from outside as well as recirculating some of the cabin air. But on the other hand, even though that is filtering out all of those particles, does that mean that you have 0% chance of having the virus contact your respiratory system? No, it doesn't mean 0%, because you're sitting next to people. And in some cases, if the plane's full, you're sitting really close to people, elbow to elbow. Even with masks on, there would be a very slight possibility, depending on the masks, that you could have some infectious virus spread to you and inhaled in your respiratory system. However, if you take a lot of the precautions that are being recommended, safe distance as much as you possibly can during check-in. One of the things that I had not thought about that was mentioned in the article I read was try to take early flights, because a lot of times on an early flight, people don't like those all that much. They want to fly during business hours, and the early flights have a better chance of having empty seats, so that if there are empty seats, you could request to be spaced a little bit differently than you can if the flight is absolutely full. And also, if you can take an early non-stop flight, that would mean that you're having a better chance of getting onto a plane that has already been cleaned and wiped down, disinfected, and then not getting back onto a plane that has already had people in it for one leg of a flight. So those are some precautions that you can use, but I thought it was very reassuring to find that the air in most all planes is HEPA filtered. It did say that some of the regional planes, the smaller planes that just fly town to town within a state, some of those types of flights may not have the HEPA filters, but the major airlines do. So I'll stop there. They're safer than you might think, but on the other hand, there's still definitely a chance of exposure.
That's great. Thank you, Dr. Ellis. Any other panelists want to comment?
Yeah, I just want to comment briefly. I think Bob covered the vast majority of it very well. I just wanted to mention that this sort of does resurrect the debate about whether or not SARS-CoV-2 is airborne or not. There was a recent letter signed by 239 scientists to the World Health Organization asking them to reconsider whether the risk of airborne transmission of SARS-CoV-2. There's been some work recently from MIT talking about how far airborne particles can travel. But the World Health Organization reiterates that there's been no confirmed cases of strictly airborne transmission of SARS-CoV-2 documented. So, and my personal bias again is that these are more SARS-CoV-2 transmits more readily by these larger droplets than they would aerosols. And I think there was a comment that, you know, flight attendants don't seem to be contracting COVID, and they're exposed regularly on airplanes. I think that has a lot to do with what Dr. Ellis mentioned about the masks and PPE that everyone, including the flight attendants, wear, the air filtration with HEPA filters, and the in-between flight cleanings that occurs, I believe, every time a plane lands and before it takes off. So I think those are good testaments for how good safety and decontamination practices and wearing, you know, masks and PPE, how effective they can be to stop the spread of the virus. And I totally agree, not just, you know, if you can get up for a red-eye flight, not only does it decrease the crowd in the plane, it also decreases the crowd in the airport. So you also decrease the risk of contracting contracting the virus en route to your airplane, your air flight too. So.
Thank you very much. Those are super helpful. The next question is about food. And the question is, what foods need to be washed before eating so that you can protect yourself against not just COVID-19, but any infectious disease? How do you wash them? Do you just rinse them? For how long? Can you give us some advice?
Absolutely. I really enjoy this question. We get it, you know, year in, year out. And this is timely, you know, time to think about these things. So there has been no evidence of food being involved in the transmission of COVID-19, but we know that certain foods do harbor other pathogens that cause foodborne illness. So it's always good practice to rinse produce. So when you think of washing food, please just think of fruits, vegetables, and herbs. The things that you would find in the produce section at the grocery store or the farmer's market or your garden. And rinse these with just clean running water. And you may, for things like smaller fruits, you may want to use colander or a bowl of water. That works well for things like fresh herbs, but you know, just give it a good rinsing. And there's not a true time limit set like there is with washing hands, which is sort of a whole different thing because that, you know, involves soap. But with rinsing produce, just rinse it well. Research tells us that if you're going to rinse an apple to eat, you know, even drying it off with a paper towel to remove that extra water is a good idea. So I want to mention that. But don't directly use your sink because that can be harboring other bacteria or cleaning residues. So do use a clean container and wash things, even if they have a rind that you're going to remove, like cantaloupe. It's still important to wash that. But it's I want to remind you not to wash things like fresh produce or meat. Doesn't do a very good job of removing pathogens and may actually spread pathogens, and that food is going to be cooked anyway. But in the case of fresh produce where you're going to use it in a salad or even prepare it, it is recommended to wash it. And we're going to put some links in the chat because we get this question so much and because there's such a wide variation in produce, you know, from blueberries to watermelons, there are different recommendations. So we have developed some videos and fact sheets through the years, so we'll put some links to that. And I think that was everything I wanted to address on that question.
Fantastic. This is another question that just came up in the chat that maybe, Marisa, you might want to also add a comment to, and others on the call, other experts. This person asks, I've seen discussion on medical CME sites of correlations between low vitamin D serum levels and increased incidence of severe COVID illness, like a cytokine storm. The serum level seems to be less than 30 nanograms per ml. Do you have any information about this?
I could just briefly speak to vitamin D deficiencies. It is a fairly common problem, and I think we may have addressed this before. We do, suggest if that, testing in our region is a good idea, but I can't really address that other part. So I hope that someone else will be able to.
Unfortunately, Rebecca Jackson couldn't join us today, but I recall that in the last panel, or one of the last panels, she was talking about, yes, getting a blood test for your vitamin D levels and keeping them at, the minimum recommended blood levels. The minimum recommended supplement is, I think it's 1,000 or 1,000 IUs daily. It might be 2,000, but she had shared that information before, so we could always go back and look at that webinar recording and maybe get that answer. So yeah, and then the question about low vitamin D and increased incidence, I'm not certain that that's a very strong link and that's been extraordinarily robustly proven, but certainly keeping a healthy vitamin D level is important. Is there anybody else that has a comment or maybe more to add to that?
Hey, Nicole, yeah, just a little bit. I just wanted to mention that, there's a lot of vitamins like vitamin A, vitamin D that are important for optimal immune function. They can act to help activate certain immune cells and have those cells create certain products that can help with combating infection. So any deficiency in vitamins means that your immune system isn't working as well as it could be. And that's probably related to it. But as Dr. Earhart said, this is an emerging story, and a lot of additional research needs to be conducted before a firm link and what's causing that link can be established.
Thank you so much. The next question is about mental health. This one is talking about the signs of anxiety versus depression. So this person asks, I have a loved one who says that they are experiencing situational depression because they are so worried about COVID-19 and the future. Is this anxiety or depression? And what are some strategies for staying sane right now? Does mindfulness or meditation help?
Thank you, Nicole. That's a great question. There's a lot of overlap between depression and anxiety. So sometimes it gets a little bit difficult to know what somebody is experiencing. And so I want to start by saying, if you really are worried about somebody, or if you're worried about yourself, definitely talk to your physician or a counselor. So we expect problems with energy, with sleeping, with sometimes having a hard time kind of winding down or focusing. Those can be associated with both. And generally, and this is really simplifying it, but depression is typically characterized by being a little bit less energetic and a little bit more flat than anxiety disorders, where anxiety disorders, somebody might appear kind of more agitated or a little keyed up, more so than with depression. But probably in about half the cases, if you are diagnosed with depression, you may also be diagnosed with anxiety. So these often sort of coexist together. In terms of the situational part, the situational part, we sometimes call these adjustment disorders or reactive disorders. And so the idea is that there's something going on that is hopefully maybe acute that's causing these, so temporary instead of being more of a chronic condition. So definitely I think COVID would fall in that area of something that is it's not feeling very acute, but something that's leading to people feeling a lot of anxiety and depression symptoms. In terms of figuring out what it is, so again, you can go online and you can see what the diagnostic criteria are. They're pretty straightforward. There's cutoffs for how long you have to have them. But if you're interested in terms of maybe what to do with this, it's really important, and I know I sort of harp on this all the time, but routines are really important. And probably for depression and anxiety, one of the most important things that you can do is get into a good eating, sleeping, waking, exercising routine, to where every day you're making sure that you get enough sleep, that you're eating healthy, and that you're trying to get maybe out of the house and do some things to get your mind off some of these stressors. These are sleep and exercise and nutrition are probably the best free anti-anxiety and antidepressive interventions we have. So I really encourage people, if you're feeling like you're starting to feel anxious or depressed, to engage in those. One of the things that's really important is that you start dealing with this as quickly as possible, because typically what we see is if people aren't addressing some of these stressors in a healthy way, then they just get worse and worse. And so when we start having our sleep affected, it's really hard to be present, to be making good food choices, just good life choices if you're sleep deprived. So all of these things can be addressed with sleep, diet, talking to people. I think one of the questions is, what are some things that you could do beyond maybe the ones we already know? And mindfulness and meditation are excellent. There's a Mindfulness Monday at CSU that's free to community members if you're interested in trying it. And even if these sound like something that you haven't in the past been very interested in, I think it's really important during this time when we have so many resources available to sample things. And you can be very non-committal. You can go online and just see if you like it. See if it sort of speaks to you, and try different things. Just because one thing doesn't work for you does not mean that there's not something else that might work for you. And I want to have Sue jump in and talk about maybe some community resources.
Yeah, and that was really helpful, Deanna. I would just emphasize the connections piece, reaching out, acknowledging you need the support, and then giving that back, because we know helping others really helps us. So all of that. And for those of you, many of you are in Larimer County here, probably know about the Health District's Connections program. They have behavioral health specialists available 7 days a week. The resources have really been ramped up for mental health in our community. There are, more emergency services available. I'll go ahead and put some of those phone numbers into the chat box just so they're available. And just point you to the Senior Access Points website. We've collected some really amazing health and well-being classes, some kind of connective ways to connect with each other through some education and learning tools. So larimerseniors.org, and I'll put that in the chat box as well.
Thank you both. And I do want to point out to our participants that there are some other links that have been put up in the chat about food safety and handling fresh produce, et cetera. So please do copy those down if you would like to get more information. The next question is also in that same realm of mental health. This person says that their adult daughter is drinking at least 2 glasses of wine a night. She says it's because she is homeschooling all day and needs to take the edge off. I think we can all relate. Is this behavior something to be worried about? Because this person says they have alcoholism in their family.
Yes. So I don't want to under-pathologize, and I don't want to over-pathologize anyone, because it's a really stressful time for everyone. I will say that for this person who is drinking more, they are not alone. I think alcohol sales in the US are up by about 30 to 35%. So people are trying to find ways to self-medicate to deal with some of the stress. So it's hard to say, do I need to be worried about it? It's not necessarily 2 drinks doesn't necessarily mean that this is the beginning of the end for someone. I will say that sometimes we minimize some of the negative effects of alcohol, and I think that's important to remember if you're using it to try and help you kind of calm down and sleep. What we also know about alcohol, especially if it's used excessively, is that it may sort of help you nod off, but then you have poorer quality sleep the rest of the night. And so sometimes I think people don't know that and they say, no, I'm using it because it helps me sleep, but it may actually be causing more problems in terms of quality of sleep. The other thing is I think we sometimes use it to sort of calm us, but there's pretty good evidence that it after a couple of drinks for women, maybe 2 or 3 for men, might sort of have some negative effects on emotional regulation. So more irritability, more responding emotionally to stuff maybe you wouldn't have before drinking. So I don't want to say whether or not this person needs to worry. I would say that she probably wants to kind of monitor if she's needing more alcohol. If she is needing more alcohol with time, then that's probably something we want to be concerned about. And if she's seeing any of these negative side effects that maybe are making the benefits not as worthwhile as we might think, like the problems sleeping through the night or any of the irritability. I will say also that we use this in the same way that I would tell somebody with anxiety or depression to try some of these other things. This is to deal with stress. And so if the person is feeling like maybe they need some other ways to alleviate stress, then I would go back to mindfulness, meditation, trying out some things to kind of wind down that are not alcohol related. But I also don't want to say that everybody should not be drinking anything either, because that's probably not realistic, and it probably really is an individual to individual basis. So maybe a self-inventory and then trying out some other things, maybe taking a checklist and making sure there's not some negative consequences. And then I would just suggest, as I always do, to be really patient with our friends and family and loved ones. People are dealing with things that they didn't sign up for and that they really don't know how to handle. And so just kind of being supportive and trying to help them through it is probably the best thing we can do as friends and family members.
Thank you so much, Deana. That was super helpful. Okay, the next question, this person says, the CDC just came out with new guidelines saying that most people don't need to be tested unless they have symptoms, even if they've had known contact with someone who is positive. This seems completely opposite to the previous guidelines. Why is it so confusing?
Well, I'll take a stab at that to start with. And I just read those guidelines and I printed those out. It's about 3 pages. They were issued August 24th, which was 10 days ago. And contrary to some of the things you've heard on various news outlets, they're not all that different than they were before. If you've had a known exposure, they recommend, and if you had that exposure for 15 minutes or so, then they do recommend testing. If you're a person in the vulnerable group, in other words, age-related vulnerability, comorbidity vulnerability, you've been exposed, or somebody that you know was exposed, tested positive, then they recommend that you get tested. They say that if you're not in one of those groups, a younger, healthy person, and you're not sure you were actually exposed, then rely on advice from your medical group on whether or not you should be tested. So to me, it wasn't that big of a change, but I can see where people might think it was a big change. So I would say if you really want more details on that, go to cdc.gov and look for the overview of testing for SARS-CoV-2, COVID-19, and their testing overview, and look for the one that was published August 24th. So there's a lot of different information, a lot of good information there. And rather than me try to go through that all right here, it would take more than what we've got time left for. So I think it would be best just to go look that up.
Thank you. Yeah, and you know, you wouldn't have that impression from the media coverage of this. It's caused this firestorm of controversy in the media. So it's really nice to just have that fact-based response. Dr. Ellis, thank you.
Sure.
The next question is, this person says, we have heard of elders being scammed by people pretending to be contact tracers for COVID and asking for credit card or bank information. Is there anything you can share to help people know the difference between a legitimate notice and a scam? Anybody want to field that one from our expert panel?
Well, I can take a little stab at it. This is not my area of expertise, but I can tell you that contact tracing is a specific protocol that is followed, and that includes when they contact an individual whose name they received from an individual that has tested positive. They will tell you the person that has been exposed. And they will never ask you for personal information or financial information. There is no cost associated with giving information during contact tracing. So if there's anyone that's asking for any kind of personal information, a social security number, if they're asking you to pay for contact tracing, I would just hang up on them.
Perfect, thank you so much, that's great. This next person asks, they say eventually winter will arrive and Coloradoans will return to the indoors. This would be a good winter to have optimal air circulation. How does one evaluate the effectiveness of air circulation in their homes? And what is optimal airflow? They're concerned about the fact that there'll probably be many products on the market that are advertised to improve airflow, but they have no idea how to pick one that is effective.
I'll take a very short stab at that. And if you were to check your furnace filters and make sure that your furnace filters are working correctly, you do have recirculation of air within your home. And most homes will have a way of pulling air from the outside also to ensure that you have plenty of air to make your furnace operate correctly. Check and make sure that the outside air is able to come to the furnace. And also opening a window a little bit from time to time can help with getting fresh air into the house. Even when it's fairly cold, you can do that and still get some good fresh air in. But there are also filters that you can buy that will assist with getting more than just dust particles out of the air. I am not sure what the efficiency of those additional furnace filters or upgraded furnace filters is, how efficient they are. And also, I don't know what the expense would be. But I think the main thing is just keep some fresh air coming into the house and making sure that you're allowing the fresh air to circulate. Then a lot of times too, we'll stay indoors more in the wintertime than when we have better weather outside. Take a chance, bundle up a little bit, get outside and breathe some of that fresh air. So I think all of that helps keep you healthy, not just from COVID, but overall in general, get better exercise and everything. So I'm going to leave it at that, and maybe others have more to comment.
I guess I would just add real quick that there are some, heating, venting, air conditioning companies that you can call that can evaluate your airflow in your HVAC systems and maybe recommend some filters. But I would caution you, as Bob said, I'm not sure about the efficiency of those filters, and I'm not sure that they can make any claims. For example, that they're as efficient as a HEPA filter, for example. And so, an HVAC company may approach you and say, yeah, we have a COVID-19 package where we'll put in a bunch of filters and that should, make your house COVID proof. There's no such thing as that. So, you'll have to sort of be an educated consumer and weigh whether or not those companies, if they're trying to sell you something, if it's really worthwhile.
Thank you both. I'm going to go back to a food safety question because I think I skipped it earlier and I thought this was an excellent question. This person asked, can I get COVID-19 from a food handler who has packaged my food? For example, I keep hearing about meat packing plants that have outbreaks in their workers. How safe is poultry and beef?
Well, I'll start with the first part of that question. And food handlers that work in restaurants have received training to follow protocols to prevent bare hand contact. And there are many protocols in place right now for retail food workers to prevent the spread of any kind of pathogen. And then the same goes for packages of food. There hasn't been evidence of anything transferring, like say from packaged beef at a grocery store to a consumer. But for the meat packing question, I'm going to hand that off, I believe, to Bob.
Okay, I'll take that handoff, but I won't address that an awful lot. But just from a practical standpoint, the chances of you getting a respiratory disease from a package of meat or any food product is very remote. And there was a little bit of anxiety on that to start with, but I think over the last few months we've seen that we can pretty well rely that the respiratory transmission isn't going to happen from a food product. And even if somebody in the packaging line or in the food processing line ended up positive for COVID-19, the chances of that virus surviving and getting into your respiratory system to cause an infection is very, very, very low, especially if you handle it as Marisa has mentioned earlier. Wash it properly, prepare it properly, cook it properly. As far as meat and poultry is concerned, or red meat and poultry, the biggest concerns are not from COVID or SARS-CoV-2, which causes COVID-19, but it would be more from bacteria, other types of contaminants that might be in the meat, especially if it's ground meat of any kind where you won't have the pathogens just on the surface. You'll have it mixed throughout that piece of meat. And that's why it is really important that you cook to an internal temperature of hamburgers and other types of ground meats to a degree that should inactivate the bacteria that are present. If you're looking at other types of meat like steaks and intact muscle type meats, when you cook those, if you get the outside seared, there shouldn't be that much on the inside. So that's why a rare steak is a lot more safe than rare hamburger. Do not eat rare hamburger. Cook it at least medium, and that'll help overall. So back to the main question: COVID-19 spread through meat handlers, meat packers. I think that's just negligible. I won't say impossible, but negligible.
Fantastic, thanks. This one, the question talks about the number of people that should be in a room. So they said, can you explain how to determine the appropriate number of people that a certain size room can hold? This could help people figure out appropriate size for holiday parties and family get-togethers. Looks like maybe Bob or Mark were going to comment on that one.
I really don't have a lot to say about that. I think that if we go back to some of the social distancing and other things that we've had given to us, but also if you know the people that are at the party and they're not coming from all over the place, if there are close friends, close associates, you know that they've been relatively careful, know the group that you're inviting, then I think you can be relatively safe. But I don't think we can say there's absolutely no risk involved with this. And it's not just COVID-19. There are other diseases. Influenza season is starting up. Get your influenza shot by all means. And if you're in the older demographic, get the flu vaccine that is meant for the older population. population. And I think I'll pretty much leave it at that.
Yeah, and I'll just add that I agree. If you're having family or close friends over, you've probably been around them a little bit, and they may even be considered part of your sort of pod or bubble. But I would still encourage, while it's still beautiful outside, you know, Colorado has great fall weather as well, to try and host as many of those gatherings outside in your backyard or in your on your deck or porch as possible, to minimize that closer quarters indoor environment. So I'll give you a little math here, okay? So we've been trying to figure out how many people, for example, at Colorado State University can fit into a laboratory at one time or a classroom at one time safely. And if you consider that 6 foot distance recommendation, that's a 6 foot diameter. So it's like a 3 foot radius around you. So almost like your arm's length on either side. Simple math, you know, if you remember your simple math, pi r squared gives you an area. So if your radius is 3 feet, and that's determined by, you know, a 6 foot distance between you and the next person, that works out to about 30 feet, square feet per person. So if you take your dimensions of your room, and I say, I don't know, a typical living room is 500 or 600 square feet, and you divide that by 30, you know, you can fit quite a few people in your room that way. But I would just go back to our first statement to say, you know, invite family and friends over, have them on the porch, have a nice barbecue, and as much as possible, avoid cramming your whole family into a small space. If you do that, though, again, and you're not sure if they are part of your pod, I would encourage wearing a mask indoors.
Thank you very much. I do want to encourage those who are listening to continue to type in questions, because we may even have more time than usual at the end. So please don't wait to the end to type your questions. The next question on the list of pre-submitted questions are about face coverings. This person says they have heard that bandanas or buffs or gaiters that were used as face coverings actually enhance the spread of COVID-19. Can you comment on this and other face coverings?
I tried to read up on this a little bit, and I didn't find anything that said that it enhances, that the gaiters enhance. The thing that it did say was that they don't hold back the smaller droplets as well as some of the other face mask coverings do. But as far as enhancing, I couldn't find anything that stated that. So the better that a face covering will hold droplets, and Mark mentioned droplet transmission earlier, but the better that the face covering will hold those back, the better they're going to function. The thing that really kind of irritates me is, and this goes along with being in public, eating places, people that think if they've got something hanging around their ears, it's protecting the respiratory system, and it really doesn't. Get realistic, people. If you see a lot of these masks that are maybe hanging on somebody's chin, they don't breathe through their chin. You breathe through your nose and your mouth. And then other people will barely have them up over their mouth. Their nose is still there. They need to be up over nose and mouth in order to be anywhere near effective. So there's a few places, very few, that I've been to go dining, that the wait staff and the hostess whoever's seating you doesn't wear their mask properly. I'm not going back there until they shape up. But there are other places that I've been to in the last 6 weeks or so that are very careful, and they do very, very well. So I think you can kind of pick and choose where you want to be and where you want to eat. I am not nearly as averse to eating in public places, restaurants, as I used to be. And even inside, some of these restaurants, there's less people and more social distancing inside than there is outside sometimes. So just pay attention to what's going on and make your choices based on that.
This is why I love Dr. Ellis so much. Some practical, common sense advice there. If you're wearing your face covering, no matter what, it could be an N95, and if it's below your nose and mouth, it's not effective. I would also say that any face covering is better than no face covering. It is true that different masks and bandanas and coverings have different levels of effectiveness, but clearly any face covering is better than no face covering, and it is helpful. You again want to try to use that in conjunction with recommended social distancing as well.
Thanks so much. This is Allie. Dr. Earhart had to jump off, so I'm just going to take over for her. Next question is going back to, we mentioned the flu vaccine earlier. Can getting a flu vaccine make me more susceptible to COVID-19 by using up antibodies to fight flu that could be using to fight COVID-19?
This is a great question. And Mark and I are pretty well up on our immunology. I taught immunology at the undergraduate and graduate level for most of my career. And I won't bore you with some of the numbers, but the ability of a normal, healthy human and that healthy human's immune system to build specific antibodies against viruses, bacteria, other agents that might be assaulting your body, what we call anything that is non-self. In other words, you do not want to build an immune response against yourself, because then you have autoimmune disease, which is very detrimental to your body. But anything that your body recognizes as foreign to the body, you have almost an unlimited ability to produce those specific immune responses and specific antibodies. So the antibodies that you produce that are going to protect you, hopefully, against influenza that are stimulated by the flu vaccine are very different, very specifically different than the antibodies that you would produce in response to COVID-19, whether it's a natural disease or whether hopefully in the near future we will have vaccines that can stimulate those antibodies against those infections. And if you look at the number of diseases that we get vaccinated for, you would see that we have just a huge ability to rely specifically. And there's one thing I want to mention here. I'm old enough that I remember polio really well. I've had family members, friends that were affected by polio, and I had people that I knew from time to time, both kids when I was in school and then adults that died from polio in the 50s. We have the vaccines, first the Salk vaccine, and now the Sabin vaccine. And last week, the World Health Organization announced that now the continent of Africa is free from wild polio virus, which means the only polio viruses there are the attenuated viruses, the ones that don't cause disease, that are in the Sabin vaccine. So this is a huge milestone in worldwide health and world battle against polio. So it takes a long time, but with the proper vaccines and the proper healthcare systems, we can see where we can make great headway against some of these diseases.
Yeah, I think Bob nailed it right on the head. The antibodies and the other immune cells, T cells, that are important, especially for viral infections, are incredibly specific for each pathogen, so that, you know, antibodies that are going to recognize the flu virus is very little chance that they're going to cross-react and recognize the SARS-CoV-2 virus. Although not absolute, but specificity is quite high, and Bob is correct. We have almost unlimited ability to make antibodies. Unfortunately, as we get older, that ability does start to wane, and that's why, you know, older folks sometimes are more immunocompromised, because they start losing that ability to create as many antibodies as they could when they were younger. But yeah, and in fact, you know, there's emerging evidence that creating an immune response to one pathogen can help bring in some helper cells that help create immune responses. Those helper cells can actually help create, that were sort of recruited there against one pathogen, can help stimulate an immune response against another pathogen. We call that an adjuvant response. And so rather than sort of competing immune responses, they enhance each other. So not to worry about getting your flu shot. In fact, it's super important, especially this year, that we all get our flu shots.
Thank you. Going to testing, what are the different types of tests and why is it taking so long to get results? And can you tell us about the new rapid test?
Yes. Yeah, unfortunately, you know, the testing delay has more to do with sort of the pipeline of receiving those samples and being able to get them to a testing site or a testing platform or machine, and limits on the personnel that can administer the tests. You know, there's a sort of big supply chain there, right? And during this whole pandemic, we've experienced issues with different aspects of that supply chain, from swabs to the tests themselves, to the containers that the swabs go into, to the machines that can read the tests, to the reagents, the fluids that we need to process the tests. And so that contributes to the delays in testing. That has improved over time, but you know, any test that takes more than 2 to 3 days to get back really becomes useless in terms of contact tracing. It's good for that individual, but not so good for trying to stem the tide of future transmission. This rapid antigen test that you've heard about, I think Abbott Laboratories has the one that's been employed most broadly. I think about 30 million of these tests have been distributed nationwide. That is a test that's very similar to a home pregnancy test. So it's on a little card, and it uses some absorbent paper to lift up. So you do, first you take a sample. So you do the typical nasal swab, and you put that swab into a solution, a buffer. And then that buffer is used to load this little card. It's basically a paper card that you can dip into that buffer that now should contain, if present, a virus in that solution. And then it like a paper towel, it wicks up into this card. And somewhere in that card, you're gonna have antibodies. So the things that we were just talking about that we all make, but these are antibodies that are produced in a laboratory that are now embedded in that card. And those antibodies will typically recognize a protein on the surface of the SARS-CoV-2, usually on the outer surface of the protein. So that antibody will bind to the virus if the virus is present, and that antibody then it will be linked to another chemical, or maybe even another antibody that has a color, a colored molecule associated with it. And if it reacts, then you get a little color change, just like a home pregnancy test. And so that's how those things work. They aren't as sensitive as some of the other diagnostic assays that take maybe a day or more, but they are good for sort of a pre-screening. You might recall that Governor DeWine from Ohio had a rapid antigen test that tested positive, and then he did the more sensitive test, the PCR test, that was negative. That is very unusual. Usually it's the other way around. These rapid antigen tests, usually if they're going to give you a false report, it's going to be a false negative. In Governor DeWine's case, it was a false positive. But that's the basis for most of these rapid antigen tests. I think in the laboratory, they're trying to develop a rapid test that doesn't identify those molecules on the surface of a virus, but actually the same nucleic acid, the RNA, that these more sensitive tests can detect. But I don't think those are commercially available yet. These rapid antigen tests are the antibody tests that are recognizing things on the surface of these viruses.
Great. Well, are there any other questions from the chat? Anybody in the audience have anything that they want to ask before we finish up? Just got one. I'd be curious to hear thoughts on initial vaccines for COVID when one receives full or final approval. I'm willing to bet there will be some fear amongst the public about a new vaccine, especially one that has been developed rather quickly.
Personally, I don't have any fear about that vaccine, but that's my personal thought. And I don't really believe that there have been too many shortcuts. I think a lot of the ability to bring these vaccines to the marketplace as rapidly as they have been brought is because of the huge effort by the developers of those vaccines. And there is testing that has been ongoing now to show, first of all, that they're safe, and then second of all, that they do have an efficacy that would make them worth administering to many individuals. So we've got at least 2 vaccines right now in the 3rd phase of trials. And as soon as those are available, personally being in the older age group and other comorbidities, vulnerabilities, when those become available, if I can be about first in line, I'd be really happy to be there. So I know everybody won't share that attitude, but that's my attitude.
Yeah, I totally agree, Bob. You know, when you do through these clinical trials, phase 1 and 2 are phase 1, bottom line has to be safe, right? And so if it passes phase 1, it already has cleared that hurdle, that safety hurdle. Phase 2 is it doing what it's designed to do? That is it generating an immune response? Is it generating antibodies? At least for the ones that are now proceeded to phase 3, the answer is yes. So phase 3 is really now, does it work against the actual infection? And that's where we're at right now. And if it passes that, it's going to be safe. You're going to be generating an immune response. Whether or not it's completely protective in every individual, certainly not, right? We know that flu vaccines don't protect absolutely everyone, but we do know that they're safe. So I would not hesitate to get a vaccine straight away. And at least in 2 of the vaccines, especially the one from Oxford, you know, this is a tried and true way to develop a vaccine. It's super straightforward. We've been using this technique for almost 2 decades, and we've generated a whole host of different really effective vaccines using the same strategy that the Oxford vaccine is using. It's been proven to be safe every time this strategy has been used. I wouldn't hesitate at all to get that vaccine.
Okay. Thank you for that answer. Looks like our time is about up. So I would like to thank again our experts for sharing their knowledge and their time with us today. Just a reminder for everyone, the recording of this webinar will be available for viewing, and we will send the link to all of you who have registered, who are here now, as well as make it available on our website at the Center for Healthy Aging. And of course, all of our community partners are welcome to provide the link on their websites as well. So thank you everyone for this awesome discussion. And please join us again next month for our next expert Q&A. We will get back to you on the scheduling of that. Everyone have a good day.